All right. Hello, everyone. Well, today we have a very, very, very special panel interview with the University of Delaware's DPT program. We have a ton of great professors, associate professors, and department chairs here, and also a current student who's actually in the DPT program. So, in today's interview, we're going to be talking all about what University of Delaware offers and what their program and curriculum is about, and also some inside scoops on how you can stand out as an applicant if you are applying to the program. So I'd love to introduce Miss Dr. Reisman first, and then we can go with Dr. Miller and then Mr. Bryan. And I'd love for you to introduce yourselves.
Great. So my name is Darcy Reisman. I'm professor and chair of the Department of Physical Therapy here at UD, which includes our DPT program, other graduate programs, as well as clinical services and a large research portfolio.
My name is Jeff Miller. I'm Associate Director of Clinical Education here at the University of Delaware. And I'm based out of our physical therapy clinic on campus, where our students do rotations, part-time integrated clinical experiences before they go out on their full-time rotations.
And my name is Brian Matthews. I'm a current DPT2, so I'm a year 2 student here at the University of Delaware.
Awesome. Thank you, everyone, for your beautiful introductions. So I'd love to just jump right in. Feel free to chime in, but just to love to get a little brief overview of what the program is like. I know I looked online and you talked about like core values and different pillars, and all of that is super amazing. I just love to just jump right into that.
So I'll start and then I'll let Jeff and Brian fill in the details. So the department, we like to think of ourselves as a three-legged stool. So we have our education arm, I should say leg, our education leg, our research leg, and our clinical leg. So we have the DPT program, which is really the hallmark of the department. We also have a very robust PhD program. So we have at any given time about 25 PTs who are getting their PhDs with our research faculty here. We also have robust residency and fellowship programs that we offer. So that's sort of the education side. The clinic side, we have our sports and orthopedic clinic and our neurologic and older adult clinic. And I'm sure we're going to get into this and Jeff will elaborate, but those clinics, the purpose of those clinics is to educate our students, to do research, and to provide outstanding clinical care to the community. And then we have our research leg, which involves PT research, spanning from pediatrics to geriatrics, neurology, musculoskeletal research. Probably the only area that we're not largely representing is cardiopulmonary research, but every other kind of research, we're doing it here at UD. And I'll let Jeff maybe talk a little bit more overview about clinical education for our DPT students.
Yeah, I think we're in such a unique space. We're in a building that we moved into in 2014, and when you're here on campus, you can really see those three legs of the stool in person, where you come into the first floor of the building and our clinic is on the left and the research labs are on the right, and then up on the second floor is the classrooms. And just the flow of information is really cool, that it can come from research right into clinical practice and right into the classroom, or questions from the clinic leading into the research. And so it's just a really unique place. And having this clinic on campus is really something that sets us apart, where the students get to come in their first and second year and get early exposure where they're really treating patients. We use a 2-to-1 model, and 2 students to 1 clinical instructor, and each student has their own schedule. And so they're really getting their hands dirty and getting valuable experience while they're still taking classes and integrating information from the classroom right into the clinic. And it really prepares them very well for when they go out on their full-time rotations at the end of the program.
Brian, do you want to add anything from your perspective about sort of the overview of the department, the three-legged stool, and what you kind of feel as a student?
Yes, ma'am. So honestly, I'd say it's kind of amazing, especially when I speak to like the research part, and I see a lot of my classmates who are on that PhD route, because I'm personally not. And just the exposure that they get and the fact that they can translate it over to the class is truly amazing. To speak more about what Dr. Jeff was saying, ICE is probably one of my favorite experiences so far in this program. It's funny because you come into it, and I think it's one of the scariest things.
Mhm.
Initially, it's like I have to treat patients like I'm a student. I'm just getting here, and then you get into the clinic and you kind of find your groove, and your CIs, your clinical instructors, are just so knowledgeable about everything that you progress very rapidly. And before you know it, it's something that you're looking forward to, and you actually feel like a real clinician. So I think the fact that the program kind of pushes you into it and gives you the tools, and also gives you that reassurance that initially it's going to be a little rocky, but you're going to slowly like get your footing. It kind of creates that sense for you. It puts you in a great position, and I think it's been very helpful for me personally.
Wow. I would say it must feel really good to hear that personal feedback from the students to the professors and the department chair to just hear what a benefit you're doing to the current students right now. I'd love to dive in. It seems like University of Delaware has a lot of academics heavy, research heavy, clinical experience heavy, where you have a PhD program, residency, fellowship, clinical sites directly on campus. I'd love to hear kind of like your perspective on that, why you do that, and like your maybe success outcomes from all of that.
Yeah, so I can tell you from my perspective why we sort of do it, and then Brian and Jeff can fill in some of the successes, and Brian can give his perspective as a student. So we really believe that it's the responsibility of any academic program to contribute to the knowledge of that profession. And so we think it's really, really important that we have this research component to our department, and we're contributing to the knowledge that's driving the profession forward. We think that that is a great thing to for the profession in general, but also to expose the students to whether or not you want to be a researcher or not. Certainly, that idea that that's a possibility, and that we like to tell the students they can do everything from dip their toe in the water and just do some like lab rotations all the way to doing research. And then also we yeah, right, it's like whatever they want to do. And also from the perspective of we sort of the hallmark of our program is our DPT program is experiential learning. So we really think the best way for students to retain information and learn to really problem solve is to give them experiences. So one of the main ways that we do that is through our integrated clinical experiences in our clinic. The clinic also serves a really, really important role in that it really helps us make sure in our academic program that we are teaching the students what is, the most clinically relevant and evidence-based information that is out there. So it's the clinic is sort of the blending of the education and the research, right? It's kind of the place where everything comes together. And so I think our culture really is that all of those things need to work together, and that we would not be as good a program as we are without any one of those components, right? They're all really contributing their own piece to the puzzle. And I think the experiential piece is really, if you want to talk about like the cornerstone, our PhD program is very experience oriented. Our DPT program is very experience oriented. As Jeff said, really getting in there and getting your hands dirty. And as Brian said, maybe even before you think you're ready, right? But our job is to make those experiences appropriate to wherever the learner is in their trajectory, right? So that even though it feels really scary, very quickly they realize we're expecting of them only what they're capable of doing. And so I think that really, that very purposeful experience that is developed with the learner, I think is a really important piece to our program.
I love that. Oh, sorry. I just want to affirm that I just love the application and integration of the clinical experiences, and just putting knowledge into practice and getting your feet wet as early as possible, and kind of having a safe and protected exposure to the clinic. Especially probably in your first or second year. I remember when I was at that time, it was very scary as well. But it sounds like University of Delaware has a great system and really purposeful with how they have integrated all this throughout the entire curriculum, all the way through the PhD level. And I just want to say, like, that's really amazing and really unique as far as what University of Delaware really offers.
Thank you.
And I think to your question about, the successful outcomes, I think, a lot of that goes to the clinical experiences and some data that we're collecting right now. And, these students, each rotation and the two that they do are 70 to 80 hours. So they have over 150 hours of treatment and documentation, really being responsible for patient care with oversight before they step foot in their full-time. So when they go out on their first full-time rotation, and we have CIs that haven't had our students before, they're expecting a student coming in for their first clinical rotation day one, and then what they have arrived to them, they're like, wait a minute, this does not feel like a first-time student, because they have those 150 hours already of treatment. And
Wow.
so they're a little bit ahead. And the data we're collecting is showing that they're reaching entry-level outcomes earlier in their clinical rotations, and that's allowing them to take the next steps to really advance their skills. And they're not
Mhm.
just fine-tuning how to take range of motion, but they're getting into higher level clinical reasoning, because the CIs can spend the time on that because they've already mastered those other things. And so to have the real data to support that has been really cool to see.
Mm. Brian,
Yes.
I would love your insight on, being a current student, like what it feels like for you.
Oh, for sure. To piggyback off of that, I think another big thing is like they don't coddle you in the program. And it's like if
Mhm.
you want to go forward and take more steps, they allow you to do that. One thing I realized is that being a student, I had other friends who were going to other schools, and like even speaking to them on the phone and telling them all I'm doing, they're like, we're not doing that. And it's like they're letting you do all that. And I'm like, yeah, they are. And they're like, whoa. And I'm like, whoa. It's one of those things. And even outside of that, from our volunteer experiences, they do a good job of sending us opportunities. And those opportunities are a lot bigger than what you think. I just had
Mm.
one working with the Special Olympics. So it's like being able to really branch outside of that. And then kind of like what you were talking about, how having everything on one campus. Dr. Jeff works like really close with the sports residency program. They've
Mm.
been allowing me to shadow some of the sports residents because they know that's my interest. So
Wow.
it's like not only like having opportunities inside the program, but if I ask, okay, you want to do more? Here's more for you to do. So the
Wow.
fact that they allow you to do that, I feel like is amazing.
I'm getting chills just learning the in-depth, just the intricacies of what University of Delaware really has to offer. I tell students, I coach hundreds of students every single application cycle, and they say, Justin, like, I'm accepted to these different programs. Like, which one should I choose? And I have some objective measures and kind of some things I kind of go through them by. But I said, at the end of the day, you really just want to be an outstanding clinician. And so wherever that you choose, you want to just have that internal gut feeling that you're going to be set up for success, that the program is going to take care of you. And ultimately, like when you go out and you become a DPT, you don't want to be doing like rudimentary things. You want to have the confidence to be able to treat pretty much almost everybody that comes in. And of course, there are going to be some cases where a little bit more complex than others, but where you feel really confident in your capabilities just right out the gate. And it definitely sounds like University of Delaware's program offers that and just helps students rise above just like the status quo, like helps them go way above that. So, Brian, I appreciate you saying that. Jeff, I appreciate you mentioning that. And Ms. Darcy, I really appreciate you sharing all that information.
Yeah, and I was going to
Go
just,
ahead.
I just want to piggyback. So Brian is, a student who really is looking for opportunities, right? And takes
Mm,
initiative. And I will say, I know we're going to get to this later, Dr. Lee, but I wanted to mention, that is something that we're looking for, right? We're looking for that student who
yes.
really, wants to take advantage of the different opportunities that we have here. And so I think, Brian, I just wanted to mention that since Brian is
Mm.
here on this call because he is a student who likes to take advantage of opportunities.
Just soak it all in and just say yes to everything, right? I'd love to hear a little bit more about what your class size is like, how you set students up for success. If a student is, failing or struggling, how do professors help aid in the success so that they don't fail out type of thing? Like how can students feel secure in their, I guess, place at University of Delaware?
So I'll tell you sort of the nuts and bolts of it, and then I think Brian can certainly fill in from the student perspective.
Mhm.
So few things. Our class size is 60 students. We often start with a little higher number than that. So sometimes we'll start with 62 or 63.
Mhm.
But kind of we're looking for about 60.
Yep.
And we really, one of the things that we really emphasize very early on in the program in the orientation is the services that are available on campus for students, but also we have a peer tutoring program. So we will pay, second year students and sometimes even first year students to tutor other students in the program.
Mm.
And we think that that is a really important learning tool for both the student that is getting tutored, but also the student that is doing the tutoring. Plus it puts a little cash in their pocket.
Right.
And the other thing that we're doing a pretty major curriculum review right now. And one of the things that we're really focusing on is an even more purposeful than we have right now, building of skills and integration of skills. Because one of the things that we're finding, especially coming out of COVID, is that students have had the knowledge, but it may have come in a bit more of a disjointed way than the students that weren't in school during COVID. And so it really relies on us to be more purposeful with the integration, but also more purposeful even in helping them develop like the professional development skills, right? And really being very purposeful in how we're doing that in the first year, how we're doing that in the second year, etc. So I think one of the things that we're really working on as a program is not just making sure that the content is all there and the evidence is there for the content we're delivering, but also making sure it's really purposeful in how we develop the students, not just from the didactic curriculum, but also from a communication standpoint, a professional standpoint. Because when there's a mismatch between what the students feel like they're capable of and what we're expecting, that's when we run into challenges.
Absolutely.
I don't know, Brian, what you'd like to add from your perspective.
Yes, ma'am. No, I completely agree. I think another big thing is kind of from the beginning, once we got in here, a big emphasis is community. So we have this buddy system. So once you come into the program, you get a buddy in the year above you, and it's kind of somebody you can like go back and forth with if you need help with notes. Is really beneficial. And I think one thing that I've really enjoyed is like, even as of lately, we're kind of doing more to it. So as of last week, we just added community building exercises into it that weren't really previous. They were previous, but now they're doing more to get the year twos involved. Going back to Friday, I was able to sit in and help the year ones on a palpation class. So it's like the ability to let them see us as comrades and like really foster that sense of community has been big. Because I feel like one of the scariest things, at least for me, coming into higher education is the fact that you don't really think you're ready for it or you're able to do it. So having somebody who was in your shoes be like, you got this, and once you can shake off those bugs and get into your groove, you'll be fine. I think that's a big thing because I think everybody's capable. Because if you weren't, you wouldn't have been here. You wouldn't have gotten into the program if your academic record didn't show you were able to do so. But sometimes the mental and the physical just doesn't add up. And the way that they really push us to be close with each other has helped us ease those nerves and make it through the program. Yes, sir.
Yeah, that I want to touch upon that. Like, it sounds like the culture of University of Delaware is just a lot of community, a lot of intentionality from faculty to students. I'd love to hear from a faculty and professor standpoint, but also from a student standpoint. Can you elaborate a little bit more of like your culture? Like, what should a student expect when they are on campus from the academic side and also from the peer-to-peer side?
I don't know, Jeff, do you want to talk about we just did something in faculty meeting around this.
Yeah. I mean, I think we want that welcoming culture for sure, and a respectful culture where everyone feels like they're a part of something and working towards their goals, both as an individual and as a unit. But I think overall, when I think about the program, I think there's a culture of excellence as well, excellence in research and clinical practice and teaching, and So it comes with high standards, and that's where
Mhm.
some of the stress comes to the students, but that's why we have resources in place to help them. But, we want to produce strong clinicians that have an impact on our profession. And it's really cool to go to national conferences and see the reunion of all the alumni and the PhD students that are at other programs as faculty and doing great things. And, I think it comes from that culture that, we really instill within our building here.
Yeah, and we've really been, as Brian alluded to, so we've been trying to be really super intentional, Dr. Lee, about our community. And so we had a working group of faculty that then engaged students in a model for what we want our community to look like. And so that group just presented at faculty meeting today. Now we're going to go back to the students and engage, now that we have sort of a model of what we want that community to look like. Now we're going to be putting some meat on the bones in terms of, what are some actions that we can be taking to further that community. And I'll just give you a little flavor. So,
Yes, I was gonna say, thank you.
yeah. So the sort of the four parts of the wheel are, what is the community culture? What is the community environment? And so, as Jeff mentioned, one of the key words in the community environment is, we want a respectful environment, right? Is one of the key words. The other is, what are the community relations? So that gets to how are we interacting with each other? And help me with the fourth one, Jeff. We just looked at it. Oh my God.
Development.
Oh yeah, development. Yes.
Yeah.
So how does the community develop together, and how do individuals develop within the community? Then there's descriptive words that the students helped the faculty come up with in each of those categories. And now our next step is to get an even bigger group of students together with the faculty to come up with what are some activities, what are some things we could be doing to really develop each aspect of that community. So we wanted to be a little bit more intentional about our community and our culture and how we're really developing it, so that, Brian mentioned there's a ton of opportunities. And I think one of the challenges we've had that we've recognized as of late is we were doing a lot of things, but really having that be in a structured way, so that the students can really understand like how all these things fit together, I think is really important. And also for the faculty, faculty have so many great ideas, Dr. Lee, and I'm constantly fending off, for lack of a better word, the next great idea, right? Because there's only so many hours in the day. Right. And so having this structure really helps us decide, okay, do we have a lot of things happening already in our community and our culture addressing that area? Or versus like, oh, we have an area over here we really need more activities in. Let's focus on that. So it helps us sort of make some of those decisions.
Yeah. Wow. Mr. Brian, do you have anything to add?
Yes, sir. Well, to get to the question you asked about incoming students, because
yeah.
I can't speak to that, but I can tell that it's working. One thing that I could say is kind of lean into it. Dr. Lee, I'm sure you remember one thing about PT school is that as a class, you get close quick. When it comes to palpation and classes like that, it forces you to really come together. And when I can speak to the faculty in terms of like leading to the community, that I've really appreciated is humility. I think one of the reasons I came into healthcare is because I find that sometimes when you get a big degree, people kind of hide behind it and kind of put themselves above others because they have the degree. And it kind of leads to like bad bedside manner or even things of that nature. And when I can speak to every professor that I've had so far in this program, is their ability to level themselves and look at you as if, even though I'm teaching you, we're equals, and they're always open to our opinions. There's been plenty of times Dr. Eastman has came into our class and was like, I'm gonna set up a Google form. I want to hear you guys' ideas. I want you to tell me everything, and I want to make this program better, and I want your input. Wow. And seeing someone as decorated as her or as decorated as Dr. Jeff be able to open themselves up and ask, what do you guys think, has been big for bringing us closer together.
Wow, man. Again, I'm just getting chills just seeing it from both sides of the spectrum here. Like again, like the intentionality from management to students and the clinical rotations, all of that. And it clearly shows as as Mr. Brian is mentioning here, it just, you see it and you feel it. And I could totally envision all the graduates from this program just excelling at what they do, humility beyond measure, and just like having a level of excellence that definitely rises above probably the other colleagues, especially at that entry level, which is, I think, the goal, right? With all of this. Great. So I'd love to go a little bit in depth, shift a little bit with some admission types of questions. And Brian, you can feel free to chime in here too, maybe from your personal experience at any point. But maybe to start off, just kind of in a general standpoint, obviously, the higher GPA, the higher grades and observation hours, GRE, all that stuff is important. But beyond that, let's say we have a traditional average applicant with all those different grades and numbers. What other things would you be looking for to help a student stand out during the application process?
Well, I can jump in. So I'm on the admissions
Sure,
committee.
absolutely.
I
Yeah,
can jump
absolutely.
in and then Jeff can chime in, and Brian, you can say kind of from your perspective, because Brian was he came to every open house and everything we had when he was a
Wow.
student to better understand what we were all about. So we are really looking for people who want to be future leaders in whatever way that looks for them, right?
Mm.
So it could be a future leader in that you really want to go into administration. It could be a future leader in that you want to go on and get advanced clinical training in whatever your area of interest is. Could be a future leader in that you want to do research. Whatever you're passionate about, we are looking for students who want to not just punch a clock, right? That they really want to elevate whatever area they choose to go into. We want them to be someone who wants to elevate that. I think the common way we talk about it is we want to educate change makers. So we're looking for students who want to be change makers. And so anything in their application that indicates that they are people who are change makers, can work really well with others, can motivate others, can possibly lead others, anything in their application that indicates that are the sort of the extras that we're looking for.
Could you give maybe one or two examples of that just off the top of your head?
Yeah. So we have students who are maybe they were, maybe they started, at the school they were at, they started a student organization, or maybe they took on a leadership role in a student organization. And then not just to check a box, but when they write their essay speaks to how that, contributed to their development as a person. Or when they come for their interview, yes, we're still old school. We still do interviews. We think they're so important. Students need to come and feel this place to decide whether it's right for them, and vice versa. So when they come for interviews, they can talk about it, they can speak, we can see their passion about, whether it was a student organization or a volunteer experience that they had in the community, or, something that they did that was really intentional and really showed their passion.
Beautiful. Thank you.
I think two things come to mind to add. One being, sure, the GPA is important and things, but all those extra experiences that take your time away from the classroom and showing that you've made a plan for strong time management to succeed as a student and in extra activities is really important, because graduate school is so busy, and you have a lot of hard classes, you have clinicals, all those different things. You have to be able to manage your time. So a history of success with that in undergrad years is important. And then, the other one being, I'm losing my train of thought.
Stress, resilience.
Oh, the observation hours. That's it. Justin, you mentioned the observation hours. That's something that the requirements are really coming down over the last couple of years, and there's not as many required, but I still think in some ways it's important, and especially seeing different settings, like not just your outpatient setting, but inpatient or, acute care, pediatrics. It just exposes you to what the profession is, so that when you are coming to a very rigorous program, it's what you want to do, and you're really committed to that because you've seen it and what physical therapy is all about. So I still think that's important, to get your hours in and not just hit that minimum bar, but, to really see the profession and understand what it's about.
Right. Just to follow up on that, sorry, Brian, I'll come right back to you, but I'm noticing a trend across not just University of Delaware, but other DPT programs where the minimum requirement of things are starting to get a little bit lower. Like GRE used to be required, now it's kind of optional, and used to hit a certain number, and now it's just kind of no minimum, which I've noticed in your program. Observation hours were higher, and now it's getting lower. So, just in your perspective, why is that happening?
Jeff, do you want to take this? Or you want me to?
You can lead this.
Okay, and then you can jump in. So I'll speak to the GREs. I think the GREs right now are controversial, right? In that I think there are some people that are very disadvantaged by the GREs and the way the GREs are structured. And I think we have to be very mindful of that. And I think it's the same discussion that's happening at the undergraduate level with SATs. And I heard some scholars, I'm a big NPR listener, and I heard some scholars talking about this, and they said, it's not that the SATs or the GREs are good or bad. It's more about what are they telling you about that student and how does that match with what you're looking for? And so I think the reason we have changed what we're doing is we feel like the GREs are part of a bigger picture. So for example, let's say someone was at a program and for whatever reason didn't feel like their academic record, maybe they had a really rough freshman year, maybe something happened in their personal life. Then they take those GREs and they knock it out of the park. And that can help us have confidence, right? In their academic record and have confidence in what they're telling us about what happened. So we want to use the GREs to students' benefit when they can benefit them, but not necessarily to disadvantage them when it might possibly disadvantage them. Observation hours is a very practical thing. Everything changed in COVID, right? It was very difficult for students to get observation hours. To some extent, that hasn't fully come back. And so again, different students have different opportunities, right? And so we don't want a student to not apply to Delaware who might be a really good fit for Delaware because they weren't, for whatever circumstances, weren't able to get those hours. But as Jeff said, we look very kindly upon people who were able to get those and were able to do more, but we don't want it to be a barrier. And so we're just trying to take a much more holistic view on what makes a great student. We had always been doing holistic admissions, but we realized that some of those criteria were really discouraging students from applying to us. And so we wanted to give more flexibility so that students could apply and we could evaluate their whole application. Does that answer your question?
That's very helpful. And I actually have one follow-up to that. So the GRE is a huge barrier for a lot of students, right? It's like, oh my gosh, I can't take it. And then they take it and then they don't do well, right? So let's say a program like yours meets all the requirements. They take the GRE and they, do, let's say like 140-ish, 130-ish on both verbal and quant, which, is like not the highest percentile. And so a program like yours where it says it's required, but you don't have a minimum, they're like, do I even send this? Should I retake it? Oh, I'm too scared to retake it, so I'm not going to even apply. So what would you say to that kind of student?
So first of all, the admissions process should not be a mystery. We have an amazing academic program coordinator, Ellie Wydra, who is incredibly knowledgeable. And any questions that students have, they should reach out to her. She's very prompt in getting back to them. She will help walk you through your application. I think Brian, you might have met with, it wasn't Ellie at the time. Anyway, they will help walk you through what they think your application needs. So for example, they may advise you to retake the GRE if there's something else about your academic record where they think a better score on the GRE will really be beneficial. They may not recommend that you retake it for somebody else with a different portfolio, right? And so I just really, really encourage applicants to reach out, get that guidance from Ellie Wydra. Her name is prominently displayed on our admission on our website, because every person, this is the true meaning of holistic application, right? There's not one answer for any one student. And one of the things that I say to students, there's a lot of myths out there about applying to PT school, about applying especially to University of Delaware Physical Therapy. And I will tell you that everything that people say you'll never get in, if I can find you at least 3 or 4 students that absolutely got in with that GPA or that GRE or whatever, because there was something else about their application, right, that maybe helped fill in the gaps.
Right. So if a student had like a low GPA or low GRE, if they had like a year to get involved with something or to show you that they can excel and stand out to kind of make up for that, in your perspective, what would you like to see from that applicant?
Yeah, so I think if they're fundamental classes like anatomy, physiology, and you didn't do well, I think not just because it's going to help your application, but it's going to help you be successful. You need to master that material, right? So I would say, experiences that can either retaking that class or an experience that really gave you a lot of exposure to anatomy, physiology. So some of those basic courses, I think you need to make sure that you have mastered that material, that you're setting yourself up well for PT school. In the non-conventional situation, I would say, experiences where you're really interacting with a wide variety of people, having to communicate with them, whether it's in a health situation or not, really showing, showing that ability to really communicate and work with a wide variety of people, I think is really important. I'm going to be really honest with you. You're not going to get into UDPT with a 2.0 GPA. You're not, right? So, and we will be very honest with you. Like, it would be very difficult for me to imagine a portfolio. I don't know, I guess scoring perfectly on the GRE. I don't even know, right?
Yeah.
Like that, it would be very difficult, right? With some, but don't worry, you got a 3.2 and everyone tells you, oh, you need at least a 3.5. No, right? I think, fundamental classes, you need to show us that you can master that material, right? So there's a few ways to do that. The easiest way to do that is to retake the class, right?
Right.
But there's other ways to show us that you can do that as well. And again, this is where I hate to give too much blanket advice.
No, it's okay. That's all right. This is helpful. This is very helpful. If like, you're looking at an application and, with PT programs, it's like a grading rubric, right? So you give the most points for certain parts of the application. We have to objectively kind of measure a portfolio. What are the top 3 areas that give the most student the most bang for their buck kind of thing?
Yeah. So it would be their academic performance, in particular, their science GPA. It would be their letters of recommendation and their essays are the next kind of big piece. And then third would be their interview.
Beautiful. Okay. Thank you for that. Every program is kind of different. So, having that, if a student really says, hey, University of Delaware is my number one, what are the ways that I can strategize? Because I want to do everything that I can to get in there. Like, I'm sure Brian here, went to all the orientations, preview days to, show his face and network. So maybe Brian, you can kind of chime in here. What did you do to make sure you can kind of have a guaranteed spot at University of Delaware?
No, yeah, it's actually funny hearing y'all talking about all this because I was one of those if students. Like, so it was one of the cases for me where
if you don't mind being a little vulnerable, can you share a little bit about your portfolio and stuff like that?
Definitely. So as far as my undergrad go, I'd say I was a strong student in biology for sure. Biology was always my jam, and that was my major. But I was actually in a weird case when I first came in, and kind of like what Dr. Reisman said earlier, I think intention is a big thing. I was reaching out to UD probably a year before the year I even had to apply.
Sophomore year, Brian. Sophomore year, you were reaching out, I think.
So I was reaching out to UD, and I wish she was here, but Dr. Rubel was very big for me, because to the point where she scheduled meetings with me. She went over my transcript with me. She told me what I had to do. And I say I was in an awkward position because I was in this place where when I was in high school, I was in a dual enrollment high school. So I was in a program where I could get my high school diploma and my associate's degree at the same time. So at the time I'm 16, 15, 17 years old taking college courses, and I wasn't really mentally in the place where I should be. So I took anatomy, all that when I was 16 years old, and I bare minimum made it through, had to pass C. And instead of just looking at that and throwing it away, like, okay, yeah, he obviously can't make it through, Dr. Rule sat down and had a conversation with me, like, okay, what was going on here? And she gave me the floor to express to her, like, I was young, I was in a position where I wasn't taking it as seriously as I should, and I know I can do better. And she said, retake the class. And I retook the class at Towson, and I ended up, I believe I got an A in the course. And she was like, it's enough for me. Like, it was, she was like, you're in a good place. And on top of that, coming to all the meetings and just showing like, I'm interested in this school. And I think being genuine is a big thing. I think students look at UD first because of the stature, and that's cool. I think I pulled up the list too. #1 DPT schools in the country. What are the top schools, so I can make sure I get my application in there. But somewhere along my journey, I think Dr. Reisman, we had a conversation about, I don't know if you remember, we had a conversation about it, and she said something that was really big for me, and that was kind of what she just expressed, making sure that it's a right fit for you. So it's not just it's a #1 school you want to get in, or you have all these faculty with all this, all of these accolades behind them, but is it right for you? And it switched my whole mindset coming into it. So now I'm looking at the professors like, do I want to learn from them? Are they expressing qualities that I would want to see in myself as a clinician? So I didn't have I think I even had to retake my GRE, and they told me to. So it was one of those, it was one of those situations where I wasn't the picture perfect applicant, and I knew that, but I had a lot of volunteer work. I think it was pretty obvious that I wanted to do it. And my work outside of academics, even though my academics weren't terrible, it showed that I had some intention, and being there and asking the questions and making sure they know that, you want this. And it's not just because of that, but it's because you care. I think that was big for me. And the fact that the board was so open with me was one reason I said I have to go here. I was messaging schools, emailing schools, reaching out to all the boards. And these are schools maybe ranked 100, 99, whatever their ranking is, it doesn't even, and they're not even responding to me. They weren't reaching back out to me like, okay, yeah, this is what you can do. I think within a week I heard back from UD. And immediately within the next week, I had a meeting set up to talk about what I could do to strengthen my application. So I feel like the reason the students come out so strong, and all of the instructors and professors have such strong backgrounds, and the reputation is so high because of the fact that it shows that they care. They feel like other programs didn't care as much because they didn't even want to have a conversation with me. So it was a lot. Yes, sir. I
Wow.
hope that
Thank you. Yeah, that's very helpful, Brian. Thank you so much for that.
Yes,
I think
sir.
it's always great to hear from the faculty side, and then also from the students' perspective on, just this whole application process. And Brian, I mean, and all of us here, we remember what it was like from, when we were applying, and all the stress, the imposter syndrome. It's like, I'm not good enough. And then we make it, and then we have our own story to tell. And then some of us go back and we try to enhance the whole system so that we can better set up students for success at the very end. Okay, so I got one last question here. So ChatGPT AI is huge, and I'm gonna go there. It's a tool, right, that is gonna be out there. How does the admission process kind of weed through that, especially with personal statements and essays? Because I know you guys have supplemental questions as well. And then maybe Brian, you can share maybe in a student's perspective, like, do you use it? Do you use it as a tool? Is that helpful or not in PT school as a PT student specifically?
So our process is so we're a research oriented department, right? It's all about triangulation of data. Right. So we have a lot of different ways we triangulate the information that we're getting, right? And so the information that is in the essays, how does it align with the information that's in the letters of recommendation? How does it align with what the person told us on the interview? And so there's nothing. So what I will say is that from our perspective, you can try as you might, but you cannot legislate good behavior, right? Mm-hmm. So we say that we want the essays, we want the personal statements to reflect the person, and that, if we see evidence that this is generated primarily by ChatGPT and is not really reflective of who you are, that's going to affect you negatively in the application process, right? our view in the program is that it is a tool, right? But, or I shouldn't say but, and it's a tool that can be very helpful. And you still need to be able to generate your own thoughts and ideas and communicate those effectively, right? And so it's a matter of that balance between using that as a tool. Look, when I was getting my PhD, we didn't have all the electronic databases to search for articles that we have now. Does that mean that I should make Brian walk over to the library like I had to do and like dig through these hardbound books and photocopy them? No, that would be crazy, right? He should use PubMed. He should use the resources he has. But what's more important to us is that he understands the process. So having that tool can't circumvent the process of the thinking, right? And so that's where we really draw the line as a faculty. We want to see the process of the thinking there. And that if you're using tools to help you be more efficient with that, as long as the process is there, we're okay with it.
Very helpful. Thank you. Dr. Jeff, Brian, any thoughts on this?
I'm pretty sure in one of the classes, I don't know that it was Brian's year yet, but I think they did an assignment kind of looking into it just to see where they had learned material, and then they had them put a similar question to see what they got out, and they found that it wasn't the most accurate for the current evidence that was out there. So just exposing it as a tool, but not something that you should fully rely on besides your clinical thinking. And so much of what we tell the students is that everything is gray and not black and white. So I don't think you want to rely on, something that maybe can't live in the gray as well as we can with the information that we have.
It's very true. It depends, right? That's the
Yes,
premise.
absolutely.
You got anything to add, Brian?
I completely agree. I've never been a big ChatGPT person personally. I was there for that assignment. Yeah, the information that we got from it wasn't really substantial as compared to what we were able to find ourselves. And as far as using like speech generators for your personal statement and things of that nature, I don't know, I feel like at some point morality has to come into it. And I don't think you really want to get into a school off an essay that you generated that has nothing to do with who you are. I feel like you should want to put yourself forward and present yourself in that manner. And so if you can get away with that, kudos to you, but I don't think that's feel good about in the future.
Yeah. Wow. Well, today's interview was super insightful for not only me, but all the students that will be watching. And I really hope all the students that are watching here, pre-PTs, University of Delaware's program, just from this interview and from the reputation, is exceptional. So if you want to be a student that just wants to rise above all your other colleagues, just go out the gate, entry-level PT, and just really crush it out there, and to be in a program where you really feel cared for, and to know that the administration has put so much thought and intentionality into your success, then University of Delaware might be a really good fit for what you are looking for. Before we end today, does anyone have any last words or thoughts that they would like to share?
I would just say, that your viewers, given that they're on YouTube, probably would also have interest in checking out our Instagram and Facebook. It's UDPT on Instagram, and they frequently, about once a month or so, do like a day in the life of a student. So, you get to see some of our facilities, the classrooms, the lab space, and what it really looks like as they go through their day. I enjoy watching them even though I'm here. So I'm sure from the outside, it gives some insight into what goes on here.
Great. Thank you for sharing that. Dr. Darcy, Mr. Brian?
No, I'm just, if you have questions, please reach out. Shouldn't be a mystery. Please reach out. We're here to help in any way we can.
Thank you for giving us the chance to speak. Appreciate you, sir.
You're so welcome. All right, everyone. Well, thank you for watching today's interview, and I will see you on the next one.